Can we, yes, I was gonna say.
Hello and welcome. I'm so excited that this is happening. This is a historic event. I am so proud and honored to get this started because we are just here, especially in this time that we're living in. We really need to rise together, and this is our time for it. I am Zola Wesley. I am a member of Alpha Kappa Alpha Sorority Incorporated. Also, I'm on the organizing team for the Poor People's Campaign, a national call for moral revival. I'm just so honored that this is happening. Yes, because we are going to be a new unsettling force with this collective, and we're just going to move on from there. Next, I will have Miss Yara Allen and Sahidi Ashe with a song.
We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. Until the killing of Black men, Black mother, son is as important as the killing of white men, white mother, son. We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. Struggling myself don't mean a whole lot. I've come to realize that teaching others to stand up and fight is the only way my struggle survive. We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes.
Good evening. I'm Alvin O'Neill Jackson, Executive Director of the Mass Poor People's Assembly and Moral March on Washington. We're preparing on June 20th for the largest digital and social media gathering of poor and low-wealth people, moral and religious leaders and advocates, people of conscience in this nation's history. And it's my privilege tonight, on the way to June 20th, to welcome all of you to this virtual town hall between the Poor People's Assembly, a national call for moral revival, and the National Pan-Hellenic Council and the Council of Presidents. I'm grateful for the organizing genius of Delta Sigma Theta, Reverend Erica Williams, and Alpha Kappa Alpha, Zilla Wesley, the Poor People's Campaign team, the Council of Presidents, and all of you who have made this evening possible. I invite you now to prepare for a 1-minute video. about June 20th. And immediately following the video, we will receive greetings from Dr. Everett B. Ward, General President, Alpha Phi Alpha Fraternity, and Chair of the Council of Presidents, followed by Ms. Vanetta Cheeks Rita, National Pan-Hellenic Council National President and member of Sigma Gamma Rho sorority, and Casey Coleman, International Second Vice President, Alpha Kappa Alpha sorority, and Chair of the National Undergraduate Leadership Council. They will come, but first, the video.
A powerful new movement is rising across America. We are the 140 million poor and low-wealth people in this country, and we are building the Poor People's Campaign, a national call for moral revival.
On June 20th, we will rise together for the Mass Poor People's Assembly and Moral March on Washington, a digital justice gathering.
Our nation is at a historic crossroads.
But history teaches us that people from all walks of life must build a broad and deep movement from the bottom up.
On June 20th, we will come together to lift the voices and faces of poverty in the midst of pandemic for a massive, historic online gathering that will embolden us, strengthen us, and prepare us to fight for the kind of society we know we so badly need and deserve.
Rise with us. Visit June2020.org.
Good evening. My name is Everett Ward, and I have the pleasure of serving as General President of Alpha Phi Alpha Fraternity and serve as Chairman of the National Pan-Hellenic Council of Presidents. I'm honored to join my colleagues here who are presidents of the National Pan-Hellenic Council, representing their various organizations, along with Dr. William Barber and the organizers of the Poor People's Campaign to confront poverty in this country. 90 years ago, the National Pan-Hellenic Council was founded in 1930 on the campus of Howard University. This year, we celebrate that 90th anniversary. However, we understand as a National Pan-Hellenic Council that the collective influential power of the National Pan-Hellenic Council, in collaboration with strategic partners throughout the nation, we must address the disproportionate level of poverty among African Americans and other citizens of color. The overwhelming disparity in food insecurity, healthcare, and household income, and families in poverty among our people requires all of us to take immediate action. So today, the Council of Presidents are glad to be here with you, and we look forward to being with you on June 20th as we use our collective power, representing some 1.5 million people across this country, to make certain that there is a voice for the voiceless. God bless you, and we're glad to be with you.
Good evening. On behalf of the National Pan-Hellenic Council, Incorporated, I greet you as the 34th President of the National Pan-Hellenic. I represent the collective umbrella of the Divine Nine, the historically African American sororities and fraternities. I am humbled to be the face and the voice of our collective power. The NPHC membership, as stated, is more than 1.5 million college-educated men and women who are predominantly people of color. We recognize that we, as a powerful voice who have public and influential reach, must leverage that to serve our communities. We recognize that the impact of COVID-19 in the midst of this pandemic is affecting our communities more disproportionately than any other. As a healthcare professional, I understand the implication of predisposing health history. However, I also understand the systemic problems in our society that make our communities more susceptible in a healthcare crisis. Inadequate education, access to preventative medicine, and economic disparities are just a few of the variables in this situation. Under the umbrella of collective action, I'm excited for a major initiative and national partnership that we have with the National Institutes of Health, working with the All of Us research program. This began in the fall of 2017, initially to educate our communities about the importance of participating in research. Over time, We have had partners with other underserved groups for other areas of people who are underserved and people of color, as well as the disabled. The next phase, which is the sixth phase of this partnership with our work, will have a focus on COVID-19 in 3 areas: advocacy, serving as the voice and frontline to the underrepresented and underserved communities in poverty to be a voice where they're not usually heard. Number 2, medical literacy, communicating and educating on health matters. What does it mean to have hypertension? What does it mean to have diabetes? How does your daily life affect outcomes towards better health? And third, the digital divide. Through this pandemic, the technology helped some, but limited access has created a larger gulf between those who need access. As we develop our engagement activities, we will update you on our work and impact. Thank you.
Good evening, everyone. I first want to thank the Poor People's Campaign for providing me the opportunity to be a part of tonight's town hall. Additionally, thank you to the National Pan-Hellenic Council Incorporated and Chairman under the leadership of President Benedictine Reeder and our entire Council of Presidents under the leadership of Chairman Dr. Everett Ward, respectively, for their unwavering support and service to our undergraduate members. I am KCA Coleman, International Second Vice President of Alpha Kappa Alpha Sorority Incorporated and current Chairman of the NPHC, National Undergraduate Leadership Council. My team is composed of my second vice counterparts from each of our Divine Nine organizations and is responsible for coordinating NPHC efforts to our undergraduate populations worldwide. The National Pan-Hellenic Council Incorporated is proud to join the efforts of the Poor People's Campaign, and I am present to emphasize how crucial it is that our collegiate bodies support the efforts of such movements. As a younger generation today, we must leave our world in a better state than we found it, whether that be socially, culturally, economically, and more. This begins with uplifting the voices of poverty to encourage moral change in America. COVID-19 has continued to wreak havoc in our lives, and our undergraduate populations alone have been impacted through, at a minimum, drastic educational roadblocks from virtual classes to closed campuses, canceled commencement ceremonies, and altered employment opportunities. And this does not even factor in those with great economic challenges, some with no homes to return to. It is no secret that the Black community has been adversely affected by this pandemic. This is why now is the time to address the systematic issues that bring about economic challenges in order to brainstorm solutions to build long-lasting power for poor and impacted people. We must be the change we want to see in our society, and this starts by standing up for what's right. For it was us, young people, that have consistently been at the forefront of great change in America. We're asking the collegiates from each of our Divine Nine organizations to support this powerful new partnership throughout the month of June by sharing registration information for the June 20th virtual Mass Poor People's Assembly and March on Washington to your collegiate community, posting a 1-minute video on why you and your chapter can support and why they support the Poor People's Campaign, and then sharing informative graphics and information to spread awareness of the movement. Forward together, not one step back. Thank you.
Good evening, everyone, and thank you so much for being here with us tonight. Tonight, I have the distinct honor of introducing the co-chairs of the Poor People's Campaign, a national call for more revival. My name is Reverend Erica Williams, and I'm one of the national organizers, and I am so grateful for the leadership of the Reverend Dr. William J. Barber II and Reverend Dr. Liz Theoharis, who will come and speak to us at this time.
Good evening. My name is Reverend Dr. Liz Theoharis, and it is indeed an honor to be with you. I come to you tonight, the granddaughter of immigrants who came to this country fleeing poverty, violence, and genocide, seeking an American dream, but who instead found an American nightmare. My mom's family are Armenian. They escaped death marches and medical experiments because those in power wanted their land and resources and were willing to have them die to amass more power and wealth for themselves. My father's family were poor rural farmers and shepherds in Greece who sought opportunity in the United States but found only suffering. They were cruelly manipulated to fight their neighbors of different races and nationalities rather than band together to fight for the rights and dignity of everyone. I'm the daughter of activists and freedom fighters. My mom, a polio survivor who taught me that all life is sacred, no matter how much money you have, nor how much money you make for someone else. My father's, whose whole life trajectory was impacted, hearing freedom fighters like Malcolm X and Martin Luther King at a very young age. I've been organizing amongst the poor and homeless for 25 years and have been homeless, without health care, working essential jobs at expendable wages for much of my life. My life changed meeting Ron Casanova, a New Puerto Rican homeless activist who was vice president of the Homeless Union, who taught me that we were homeless but not helpless, and that poor people must help lead a moral movement to end poverty and racism. I'm inspired to keep on going on, meeting Callie Greer, an African-American woman from Selma, Alabama, who has lost 2 of her children, one to gun violence, the other to the lack of health care, the lack of Medicaid expansion, but who has vowed to not waste her pain, but to struggle to win housing and health care, voting rights for all. And I believe I have met one of God's prophets in Wensler Nosey, former chair of the San Carlos Apache tribe, whose most sacred lands are being destroyed by a multinational copper mining company. But Wensler has given his life, protecting the land and everything living in it and on it for us all. As a theologian and biblical scholar, I want to leave you with a few words about what the Bible really says about poverty and the poor, and why we must not believe the lie of scarcity. The Beatitudes teach, "Blessed are the poor who call out, 'I can't breathe,' for theirs is God's nation." Indeed, from Genesis to Revelation, the Bible proclaims justice and prosperity for the poor. The Exodus is a founding story of God being on the side of the poor and the oppressed. The book of Deuteronomy and Leviticus offer commandments on how you care for your neighbor is how you honor and worship God. The prophets denounce passing policies that oppress the poor. The Gospels proclaim bringing good news to the poor and release to the captives is how you are God's people. And Paul's epistles instruct the followers to offer mutual aid, mutual solidarity through collection and helping out. Poverty is not inevitable, nor ordained by God, but a result of our structural injustice. It can be ended. And in this time when 40 million people have filed for unemployment, when homelessness is increasing by 45%, when 15 million families can't afford water, and more than half of our nation's children are going hungry, we must cry out. Somebody's been hurting our people, and it's gone on far too long, and we won't be silent anymore.
Thank you so much, Reverend Dr. Liz Theoharis, who is indeed, my brothers and sisters, a sister beloved, a powerful woman of God. President Rita, Chairman Ward, and to all of my brothers and sisters who are gathered on this call tonight. We are the Poor People's Campaign, a national call for moral revival. We hear the call of the scriptures that says in Isaiah 10, "Woe unto those who legislate evil and rob the poor of their rights." We hear the call of Jesus, who said that every nation would be judged by how it treats the hungry and the homeless, the sick, the broken, the battered, the imprisoned, the immigrant, and those whom the scriptures declare the least of these. We've read the Constitution, and the Constitution says that there is no liberty worthy of being passed on to our posterity that does not ensure established justice, provide for the common defense, and promote the general welfare. I want to talk a little bit about why we have traveled across this country to more than 45 states and formed 45 coordinating committees over the last 3 years, and why the Poor People's Campaign is not another organization, but an organism seeking to bring people together who work in various silos that are very important, but every now and then need to come together in mass ways to build power and shift the narrative. I want to talk a little bit about why in this movement we consider 5 issues. Dr. King in '68 talked about three evils: racism, militarism, and poverty. We talk about 5 interlocking injustices that have to be addressed simultaneously: systemic racism, systemic poverty, ecological devastation, the war economy, and the false moral narrative of religious nationalism. And we know that very often when it comes to those issues, the same folk that are against public education are against health care for all as a human right. The same ones that are against health care for all as a human right are against living wages. And the same ones against living wages are against voting rights. And so we have learned if they are cynical enough to be together, we must be smart enough to come together. I want to talk to you about why we have 16 religious denominational bodies, national bodies, that are part of the Poor People's Campaign: Jews, Muslims, Sikhs, Christians, and why over 100 other organizations have joined the movement from the bottom up, the grassroots movement from the bottom up. You know, in this pandemic, the pandemic is like a contrast dye that goes inside your body to really pinpoint what the real issues are. And the pandemic, we learn, spreads across the wounds and the fissures of society. And America had a lot of wounds before COVID, wounds that if we had worked on them before COVID, COVID would not have some of the power it has today. Before COVID, there were 140 million poor and low-income people in this nation. 140 million. 43% of this nation poor and low income, according to studies by Columbia University and Harvard before COVID. 700 people were dying every day from poverty and low income before COVID. Before COVID, 61% of all African Americans were poor and low income. Many of them who wear our colors and grip our grips and our hugs were poor and low income, $400 away from economic destruction. 24 million people in the African American community alone. But poverty is not just limited to African American people. There were 66 million poor and low income white people before COVID. 66 million, 40 million more than the 26 million white Black people. 38 million Latinos poor and low income. 38.5 million children before COVID were poor and low income. The great shame of the wealthiest nation in this world. And then COVID happens. And we've seen the immoral fruits of this injustice in this pandemic, because poor people and people of color are paying the highest price. The highest rate of death is among African Americans due to lack of health care and lack of hospitals and lack of sick leave and lack of many things that are necessary to fight a pandemic. African American communities face many racial injustices that plague our healthcare system. But even beyond the Black community, everybody is hurting because, first of all, the things we should have done with the first $3 trillion we didn't do. Because we are locked in this country to a trickle-down understanding of economics, the first $3 trillion went up to the corporate leaders and not down to the poor and low-wealth people who were already hurting before corporate. They fed the corporations, the already overfed corporations. And the things that should have been done weren't done, like guaranteeing everybody health care as something connected to your humanity, not your job. Guaranteeing living wages, guaranteeing sick leave, guaranteeing unemployment, guaranteeing rent forgiveness, and guaranteeing that your water, your utilities couldn't be cut off. No one can say any longer that we couldn't afford those things. We chose, leadership in this country chose not to focus there, because even before COVID, too many people were too comfortable with other people's deaths and other people's despair, especially if they were poor and low income. So we had a lot of pre-existing wounds in America. And those pre-existing wounds were open and they gave entry to this pandemic. And if we don't address these inequities, the pandemic will expand even further. Every major public health specialist tells us that pandemics live and breathe and exploit the fissures and the wounds of our society. You know, before the pandemic, we called people who prepare our food and cut our meat and deliver our packages and drive our buses and clean our offices and clean our bedpans and run our nursing homes. We would call them service workers. Now, after the pandemic, all of a sudden, we call them essential workers. But when we talk to them, they feel like they're expendable workers because they got a title and a hand clap, but they didn't get health care. They got a title and a pen, but they didn't get living wages and sick leave and decent unemployment. They tell us they need living wages, they need health care. They're being forced to work and risk their lives every day. One nurse told me she's not being sent to work every day, but she's being sent to her death every day. The people who run the country too often politically don't care about the people who make the country run. And somebody has to stand up. Who are these stories that must be heard, and why on June 20th, 2020 at the Mass Poor People's Assembly Moral March on Washington, a digital gathering, why are we lifting up the voices? Not lifting up people, speaking for people, but why are we building this stage for people to be heard and to shift this narrative? I'm talking about Clara in Mississippi, who worked in a food processing plant without protections and died of COVID-19 in April. She had to drive 40 miles away to be tested and then was sent home to die. I'm talking about Dorothy Scott, a Navajo who lived with 3 generations of her Navajo family, 11 of them living in a dirt floor in a one-room home, that not having access to water because the corporations have stolen 70 and 80% of their aquifers. Her husband has died and her son has died. Talking about those in the Navajo Nation, 40% of them don't have electricity. 30% of them don't have access to clean water. We're talking about Black folk in Tachula, Mississippi, Holmes County, Mississippi, the poorest county in America now. I'm talking about Brandon, a 28-year-old father who works as a meat packer and says every day he has to choose between risking his life and feeding his children, and that some people are taking Tylenol to mask their symptoms because they don't know if they go to the hospital whether or not they're going to be treated, because if they don't have COVID, then they're going to tell them they can't get treated. I'm talking about Polly, who works in a nursing home and has to sneak in protection equipment and has to try to make equipment out of trash bags. I'm talking about the Pingles, a white farming family in Kansas whose neighbors were, even before COVID, were committing suicide in a town that had been hard hit by COVID and lacks hospitals. I'm talking about the Colbrooks in rural North Carolina that's had a family that's had 10 cases of COVID and 6 of them have died. And so you see, my friends, we have to use our power to speak up. We have to have a rising. We can't be casual. We are seeing what policy violence. And was not it Sorrelle Coretta Scott King that said it like this? Poverty can produce a most deadly kind of violence. In this society, violence against poor people and minority groups is routine. She said, Coretta Scott King said, I remind you that starving a child is violence. Suppressing a culture is violence. Neglecting school children is violence. Discrimination against working people and not allowing them to have their rights is violence. Ignoring medical needs and denying health care is violence. Contempt for equality is violence. But then Coretta said something that haunts me every night and should haunt us all. She said, and if you have the lack of willpower and an apathetic attitude toward these other forms of violence, that too is a sick and sinister form of violence. And so in the face of this, we have to decide we're not going to choose anymore the long lines, the death and the sufferings. Oh no, we can choose another way. In Germany, they chose another way and they paid the workers rather than made them go home with nothing. Many of our families are crying out. Many of them are dying, and they're saying to us, won't you all remember those who died by standing up and fighting back? Some of them have said to us, we want everybody to start thinking like this. In 48 hours, any of us could be without our breath. We could be on a ventilator. They've asked us to stop for a minute and think about that, not morbidly, but think about it. What if you knew you only had 48 hours left to breathe? What if you knew that? Then how would you use those last 48 hours of breath? What would you try to breathe into this world? If you knew you only had 48 hours of breath left, what kind of world would you fight for? What kind of healthcare would you fight for? What kind of love would you fight for? What kind of justice would you fight for? Well, some of us have decided to live in this Poor People's Campaign, a national call for a moral revival, like we only have our last 48 hours of breath left. We might live 48 more years, but for now, it's time that we act as though we don't. And we use every breath we have to breathe some love and some justice. We use every breath we have to build a stage to lift up the poor and low wealth, because they're the only ones that can change the narrative of this nation. We use the breath we have to build power and register people to vote and build the kind of power that's necessary to change. Because if we cannot change now, with the levels of poverty we have in America, the level of low income that we have in America, and with this pandemic, if we cannot change now, we cannot fight for change now, and God help us. God help us. But I believe that there's a rising happening, and all of you are a part of it. And thousands of voices you never hear, members of the Pan-Hellenic, are thanking you tonight for saying you're going to help to build this stage for the world to hear and see the faces they often ignore. And hopefully that will shift the consciousness of this nation, and we can begin building a new world. Not a normal, not going back to normal, not even a new normal. We need a revival and a revolution of moral values. God bless you and thank you so much.
Thank you, Bishop Barber, on tonight. And we hope that you have heard the message loud and clear that somebody has been hurting our people. And it's gone on far, far too long. And we will not be silent anymore. I hope you heard that tonight. We will not be silent anymore. And so tonight we want you to hear the voices of our family who has been impacted by these evils, as Bishop Barber and Reverend Liz talked about. We're going to hear from our sisters and brothers and our siblings tonight about how America has not been what she said she would be. So tonight you will hear from Reverend Carolyn Foster from Birmingham, Alabama, from the Greater Birmingham Ministries, one of the tri-chairs of the Alabama Poor People's Campaign. You will hear from Brother Keenan Harton from the NC Raise Up Fight for 15 family. And you will hear an audio testimony from Ms. Polly Henry from our SCIU family. Let us hear them, and let us hear them clearly as they come tonight. Reverend Carolyn.
Thank you so much and good evening. I am Reverend Carolyn Foster. I serve in the Episcopal Diocese in the Church of Alabama. I serve with Greater Birmingham Ministries, a 50-year-old direct services and social justice organization, and I'm privileged to serve as one of the chairs for the Alabama Poor People's Campaign, a national call for moral revival. I was born and raised here in Birmingham in a segregated neighborhood called Smithfield. Smithfield had a nickname in the 60s. It was called Dynamite Hill because my neighborhood was frequently bombed by racial terrorists known as the Ku Klux Klan. I learned early in life that the place where you live mattered. Back then, the place where you lived, especially if you look like me, was dictated by the powers of segregationists and systemic injustices. In fact, the framers of the Alabama 1901 Constitution proudly proclaimed at the Constitutional Convention law in Alabama. This provision essentially disenfranchised most African Americans and thousands of poor whites. Racial segregation by law has ended, but the tentacles of segregation still has a firm grip on the African American community. Where you live still dictates housing opportunities. Where you live still dictates educational resources. Where you live still dictates access to public transportation and healthcare and employment opportunities and food security, and whether or not you can breathe fresh air and drink clean water. Where you live in Alabama still dictates your accessibility to easy participation in the right to vote. So place matters. I live and work with people who are targets of these systemic racism and systemic poverty issues. I see and know the pain and suffering of individuals who live with health disparities, poor housing, unsafe neighborhoods, food deserts, environmental atrocities, unemployment, and all of this before the COVID-19 pandemic. Alabama is the 5th poorest state in the nation. It would take 82 hours of work per week, working a minimum wage job to afford a 2-bedroom apartment in Alabama. A few years ago, we organized and worked to get the city of Birmingham, a majority African-American city, to increase its minimum wage for its city workers. The city council passed it, but the majority white Alabama Senate quickly passed a law banning cities from increasing its own minimum wage. Place matters. We have seen 14 Alabama hospitals closures since 2010 in Alabama, primarily because of the rising cost of caring for people who were uninsured. These are people who either could not afford healthcare insurance or because their low-wage jobs did not offer it. Alabama refuses to expand Medicaid. In the meantime, women in Alabama are dying of cervical cancer, a preventable disease, at a rate similar to developing countries. And hundreds more people are sick and dying primarily because they cannot afford healthcare. Jefferson County, which primarily serves the Birmingham area, Montgomery and Mobile counties have the highest rate of COVID-19 infections and deaths in Alabama. Alabama is 70% African American. Montgomery is 60% African American. Mobile is 51% African American. So what I learned years ago about the place where you live matters still holds true. Place matters, and the people who live in those places matter too. COVID-19 has propelled these interlocking injustices of systemic racism, systemic poverty, barriers to voting rights, and inadequate healthcare into prominence. And we cannot be silent about it anymore. So on behalf of my historic neighborhood of Smithfield and all the neighborhoods and communities that struggle for survival, I will be joining thousands of others at the Mass Poor People's Assembly and Digital Moral March on Washington on June 20, 2020. Because places like these and the people who live in them matter. Thank you.
Hello. My name is Keenan Harton, and I am a leader at NC Raise Up and the Fight for 15. I'm a father, a grandfather, and a very hard worker. Before COVID, I worked at Biscuitville, and I got laid off with no warning due to this deadly virus. I don't work in fast food anymore because they don't give you protective masks. They're not passing out gloves. They're not treating their workers right. I also work at a landscaping company, and it takes 2 jobs just to make enough to get by. They are telling us that we are essential, but they treat us like our lives doesn't matter. The truth is, we're essential. Now that I'm working all this overtime at my landscaping company, I'm concerned about catching the virus. They're not passing out massive gloves either. Everyone is hurting right now. I'm making $12 an hour with no hazard pay, no health benefits, and no paid sick leave. We are all dying at a higher rate. And this is from our minimum wage jobs, and we are most likely the front line workers. It's mainly us that's taking this hit in the Black and brown communities. The business owners, best health coverage and the best equipment, while we're getting their used equipment. America can't restart without their workers. Why does it take a deadly virus for them to consider us to be essential when we've been essential the whole time? So it shouldn't take a deadly virus for them to raise minimum wage when they should have been considering us the whole time. No one should have to put up with these unsafe working conditions at work. No one should have to put up with these unsafe conditions at work. This is why we need to organize. This is why we need to form unions. We have worker rights. We have power. And we're going to keep fighting until we get this. Thank you.
Thank you so much, Danielle. And we have one more person that we're going to bring on. I wanted to say to those who are listening, I want you to know that this campaign has an agenda. You'll see it. It will be sent to you later. We already have tested it with some of the best economists. Joseph Stiglitz, who's a Nobel Peace Prize economist, has said to us years ago, the cost of fixing poverty was more than the cost of fixing it was more than the cost of allowing it to exist. We know right now, if we pay people like Daniel $15 an hour in the union, it would pump $368 billion into the economy almost immediately. Healthcare for everybody as a human right, not just as a job right, would benefit the whole country, the whole world really, because we're the only country of the 25 wealthiest that do not offer some form of health care to everybody. And when we don't take care of the poor, when we don't take care of the low wealth and allow people to lift, allow people to move forward, it undermines all of us. The federal treasurer now is saying we may have to spend as high as $10 trillion to just get back to normal, and normal is not where we want to be. And much of that spending, Erica, is because we did not do and have not done the right things. And that's why poor and low wealth people, moral leaders, and their advocates are rising to shift the narrative and build power. I don't know if you knew this, but in every state in this nation, the number of poor and low wealth, Black, brown, red, and white people who don't vote hold the power to change the political calculus. But so often our politics don't even discuss them, middle class and wealthy, but never about the poor and low wealthy, the very people Dr. King said they had the power to form the kind of unity that could transform this country. This tape I want you to hear, and then you'll hear from Dr. Sharrelle Barber, who's a public health specialist, trained at Harvard, now at Drexel, is going to lay out some of this for you from a policy standpoint. But I want you to hear this tape. It was a tape we heard on one Wednesday. It's an audio. But it's an audio of a lady who's at a nursing home. I want you to hear her plea. Thousands of people are saying this, and these are the people that are organizing with this campaign because they're saying we can't be silent anymore. Would you listen to Polly?
Thank you so much for this platform. This is a needed platform, and I'm so happy that you are bringing it to us where we at the front line can speak, because like I said, this is not the first time that we are dealing with viruses. We in nursing, we have dealt with many, many different viruses. What is new now is that you have people who is not in the medical field at all telling us who is COVID and who is not COVID. We are not protected. You know, my name is, again, Polly, and I work in Cold Spring Hills, just to make for the record. And here I am working this morning and have my coworkers crying on me. We're not, these patients are coughing and there's all type of symptoms, and the management refused to give them PPE, even though the local government give them the supplies Saturday. They refuse to give it to us. As I speak to you right now, I'm busy smuggling PPE to my coworkers. I have to wrap it, roll it tight in a rubber band to make it small, so management don't see me going to give my coworkers PPE to take care.
That is just outrageous.
I am smuggling PPE because my organizer give us PPE. These delegates, some of the delegates of us, we get a package of 10. And right now, as we speak today, I have PPE wrapping in rubber band to make it small, so they don't see me smuggle it to give my coworkers to go into rooms. Before I came down here, that's why I'm so rushed and get a little anxious, because I was smuggling PPE to give some of my coworkers who called me and said, Polly, look at this. This person's temperature is over 106, and they want me to go into the room without giving me PPE. This I could say some very strong language if you guys would allow me to say. This is like mass murder. This is what you call, we've been in this company with our long-term patients for the longest while. These people never cough, never sneeze, never have people like this. And all of a sudden, our lovely residents is just dropping dead. Last week we had the issue, the nurse had to ask them, why you management wearing masks if there is no PPE, if there is no virus? Take off your mask and walk around the unit then. Bring them and let them sit in your office then. We are, as we sit here right now, if I go on the unit with this phone, you would hear the complaints from my coworkers live. You would hear it. This is not right what they're doing. And one of the things that we need to take care of also, we can't have one owner have 25 nursing homes. This is why we're suffering, because the government gives them the supplies and they have to split it, and we become the sacrificial lamb. And we cannot continue to be a victim of the system. Because first of all, when they tell them to start reporting the deaths of the people, they tell them April 20th, just start reporting. What about the people who passed before April 20th? What about the CDC that keeps saying all you need is a bathroom? COVID patients is not even getting up to go to the bathroom coming from the hospital. The CDC did not say, you know what? Make sure you have fully staff. Make sure your staff is not floating. Make sure those staff stay in that building where those COVID patients is. That didn't happen. The CDC refused to say that. So there is a plenty of blame to go around right now. This is mass murder, and we must fix this. No more owners should be able to own 5, 6, 7 nursing homes in one place. You have nearly over 600 nursing homes on Long Island, and maybe 3 or 4 brother-in-law, father, uncle, everybody own a nursing home. So then everybody, so it's happening everywhere. It's happening everywhere because the same owners. We have to fix this.
Thank you so much. Good evening. My name is Dr. Sharrelle Barber, a social epidemiologist and national advisor and coordinator of the Poor People's Campaign COVID-19 Health Justice Advisory Committee, comprised of researchers from the Harvard FXB Center for the Health and Human Rights, the UCLA Center for the Study of Racism, Social Justice, and Health, and other institutions from around the country. Next slide, please. On March 11th, 2020, the World Health Organization declared the COVID-19 outbreak a pandemic and urged coordinated global action to curtail the spread of the disease. By all standards of best public health practice, as we've just heard from the most recent testifier, The US response to the COVID-19 pandemic has been reckless and uncoordinated, leading to the country's current status as the global epicenter of the pandemic. As of May 24th, there are over 5.5 million confirmed cases worldwide. I want to say that again. There are 5.5 million confirmed cases worldwide, with nearly 1.7 million confirmed cases here in the United States. There have been nearly 350,000 confirmed deaths globally, with nearly 30% of the deaths, almost 100,000 deaths occurring here in our country. These numbers are staggering and they continue to rise. Data released by Columbia University last week revealed that at least 36,000 of the lives lost could have been prevented had this administration and this government acted just 1 week earlier and shut down this country. This is proof that this government has been careless and has literally been playing Russian roulette with the lives of its citizens. Next slide, please. To mark the unnecessary deaths, the New York Times listed the names of many who have died. These are names, these are faces, souls connected to families and communities. It's a sobering reminder of the deadly toll this virus is having on our country. Knowing that the virus spreads in silence, has a long incubation period, that there are many asymptomatic carriers of the virus, we should have been extra cautious and bold in our action. But instead, we have failed to act and are in this moment attempting to return to business as usual by carelessly reopening states without the proper safeguards to ensure safety and justice. And we know that this is going to, as it already has, continue to have a disproportionate impact on Black communities and the poor. Next slide, please. I want to share with you some of the data because I think we really need to be grounded in and rooted in the numbers as we think about how to move forward in this pandemic. And so this data is as of May 19th from the 40 states and Washington, D.C. that are releasing data by race. This slide shows that the rate of COVID-19 deaths reported are significant. Racial inequalities are significant in the United States, and Blacks especially are experiencing some of the most striking inequalities. As of May 19th, over 20,000 Blacks have died from this pandemic, and these numbers continue to rise. We also know that the mortality rate for Blacks is 2.4 times that of whites. We know in some parts of the country that this is even more striking. In Kansas, for example, Black residents are 7 times more likely to die. In Wisconsin and Washington, D.C., Blacks are 6 times more likely to die. In Michigan and Missouri, 5 times more likely to die. And in Arkansas, Illinois, Louisiana, New York State, Oregon, and South Carolina, Blacks are 3 to 4 times more likely to die from this virus than whites. This death is staggering and it's heartbreaking, and we must continue to bear witness. Next slide, please. This is some more data showing COVID-19 deaths and how it's disproportionately impacting Blacks. We know that in this country, Blacks make up 13% of the population. However, they have suffered 25.1% of the deaths to date. And in Washington, D.C., our nation's capital, Blacks make up 44% of the population, yet 80% of the confirmed deaths. Again, we must continue to bear witness to these deaths. Next slide, please. So I think it's important that as we're talking about the death, and so many of our testifiers have already alluded to so many of the interlocking systems of racism, of poverty that are leading to this death, it's so important to remember that context. And so early on in the pandemic, as the data were beginning to emerge, my colleagues and I wrote a piece outlining with extreme clarity the ways in which structural racism would be operating during this pandemic. We understood that a proper diagnosis of the problem would be the only way to ensure proper solutions. Next slide. We knew that before the pandemic, Blacks die at higher rates for just about every leading cause of death, in this country and that this pandemic would be no different. We also knew that while COVID-19 is indiscriminate in its transmission, its propagation within a society steeped in structural racism would lead to a disproportionate impact among marginalized racial groups, including Blacks. So all of the issues that have already been highlighted, I'm just gonna highlight a few more, that we know that access to testing has been an issue. We know that researchers have shown that Blacks not only are less likely to be insured and have access to healthcare, we also know that as they access healthcare systems, they're also more likely to be discriminated against and turned away. In Philadelphia, early data showed that Black neighborhoods had less testing than white neighborhoods, despite being more likely to test positive for COVID-19. We also know that the early distribution of testing was limited in some of the most racially marginalized communities. So for example, there were two individuals, one from St. Louis and one from the Mississippi Delta, that said that early on, their federally qualified health centers literally only received a total of 5 tests for their whole community. And this is a problem. Again, we know that within the healthcare system, Blacks experience racism, discrimination, and bias, are turned away when they and don't get the proper treatment they need when they access the healthcare system. As our brother from Fight for 15 said, essential workers are literally being put on the front lines of this pandemic. They are the least protected and the most exposed and lack the personal protective equipment, income protections, paid sick leave, and hazard pay to ensure their safety during this pandemic. They are literally being sacrificial lambs in the middle of this pandemic. And we know that this does not only impact them as workers, but this has implications for their families and their communities as they might return to racially segregated communities that have, since the 1930s, been disinvested and lack the proper protections needed for there to be safe housing, access to clean water, and other exposures to environmental toxins, et cetera. Again, just to reiterate, it is the interlocking systems of racism that reinforce one another and have created a deadly cycle of exposure, transmission, and subsequent death among Blacks and other marginalized racial groups in this country. And we know this is occurring not only for Blacks, but for Native Americans, for Latino communities, for immigrant populations, and for the poor. And we have to center these interlocking injustices and move forward and demand an equitable and just response. I want to end by just saying a few more things, that as a social epidemiologist, part of my job description is to count deaths. And it has been painful to witness the disproportionate deaths among Blacks and other marginalized racial groups and the poor that are a direct result of structural racism, economic exploitation, and the reckless and uncoordinated federal response, as others have noted. This nation and those in power are far too comfortable with the deaths of some groups, and we have an obligation in this moment to speak truth to power in the midst of this pandemic. We also have an opportunity to reimagine a more just and equitable world. And so in this moment, I want you to hear the words of Arundhati Roy, an Indian philosopher and human rights activist. She says this: historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our data banks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. And as scientists in the public health community, we are ready to fight. This is why our committee of researchers affirm the core principles and demands of the Poor People's Campaign, a national call for moral revival. And we know that this is what is needed in this moment and beyond. We must address the interlocking injustices of racism, poverty, and ecological devastation, because none of us is safe until all of us are safe. And from my brothers and comrades in Brazil who have this saying that comes from an Ubuntu principle, "Eu sou porque nós somos," I am because we are, forward together, not one step back. Thank you.
Thank you so much, Sharrelle, and thank you to all of the testifiers and others. This is why this campaign is building, and even before this pandemic, we saw the pandemic of greed, the pandemic of lies, the lie of scarcity. That's why we have a budget, a poverty justice budget. That's why we have the Souls of Poor Folk, an audit of all of these 5 areas. And that's why a few weeks ago, with these experts and others, we put together a poverty amidst the pandemic, a moral response, and put together an agenda to say this is what we need both sides of the political aisle to do. You can't solve this without policy. You can't solve poverty without policy. It can't be solved just by personal charity. And so we're pushing, we're demanding, we're declaring. We have to have, we've not had one bill yet focused on healthcare. How is that in the midst of a pandemic? Living wages, sick leave, guaranteed unemployment, water protections, utility protection, education protection. We've seen some money go, but 83% of the first 3 bills went to corporations, did not go to those at the bottom. And if you do not deal with poor and low wealth people, we cannot fix this pandemic. And more importantly, before this pandemic, 700 people were dying a day from poverty and low wealth. 250,000 people a year were dying from poverty and low wealth. We had 36 presidential election debates and not one on poverty. 7 people died from vaping. We had a congressional hearing and not one on poverty and low wealth. This is no longer acceptable. And so that's why we're organizing people. We have white coal miners from Kentucky organizing with Black people from Alabama. We have farmers from Kansas organizing with Latinos from the Carolinas. People are coming together from all over, and we're so glad that the Pan-Hellenic Council is joining and being a part, because we must now, we know what to do. And scholars know what to do, and folk know what to do. The money is there. There's no longer the live scarcity, no longer works, because we found $5 trillion in less than 3 months. So that no longer works. You can't tell us we can't afford it. What we have not had is a massive mobilization of poor and low wealth people of every race, creed, color, and sexuality, connected to a narrative, connected to showing people's faces and hearing their voices, and connected to building voting power and mobilizing the many of that 100 million people who have chosen not to vote. Many of those of that 100 million are poor and low wealth, and they don't move because they've not heard their agenda. We've met them all over this country. Liz and I have met them. Eric and I have met them. Dr. Jackson and I have met them. You will meet them on June 2020. This is not just an event or march. It is a generationally transformative moment that is a part of a movement. And we want to thank you, all of you, for joining in this, because it's the only way up. We either establish justice, we either provide for the common defense, we either promote the general welfare of all people, or like Fannie Lou Hamer said, we have to question America. We have to question, if we can't do it now, can America even be who she claims? Well, I'm not ready to give up, and I know you're not either. I believe that, as Langston Hughes said, we can restore our mighty dream again. Erica, it's in your hands.
Thank you, Bishop Barber, and thank you to all of our testifiers and Dr. Sharrelle. And so I'm going to ask each of you that are watching tonight, I want you, if you have not already done it, to please share this town hall with your networks. Please share it on your social media pages, because the world needs to hear what's going on tonight. They need to know about what's happening in this country and what's been happening, because there was a pandemic before the pandemic. And so I'm going to ask you right now to go ahead and share this information with folks. And even if they can't jump on tonight, for them to come back and watch this, because I promise y'all, this is so important. Our people are dying. They are dying every minute, and we cannot sit idly by when we have the power to change this. So I'm earnestly asking each of you, share this tonight. And we're preparing now to hear from the Council of Presidents. We're so grateful for them being on with us tonight. We're thankful for the work that these organizations have done in our communities since its foundation. And so tonight we want to hear from them as they give us a clarion call as we seek to change this nation. Y'all, we ain't going back to normal because we can't go back because normal wasn't good for our people. We have got to change this nation. And so tonight we're going to hear from Dr. Everett Ward, the president of Alpha Phi Alpha Fraternity Incorporated. We're going to hear from Dr. Glenda Glover, the president of Alpha Kappa Alpha Sorority Incorporated. We're going to hear from Mr. Reuben A. Shelton III, Esquire, from Kappa Alpha Psi Fraternity Incorporated. We're going to hear from Dr. David Marion, from the Grand Basilisk of Omega Psi Phi Fraternity Incorporated. We're going to hear from Beverly E. Smith, president and CEO of Delta Sigma Theta Sorority Incorporated. We're going to hear from Mr. Michael Christel from Phi Beta Sigma Fraternity Incorporated. We're going to hear from Ms. Valerie Hollingsworth Baker, the International Centennial President from Zeta Phi Beta Sorority Incorporated. We're going to hear from Ms. Deborah Catching Smith, International President from Sigma Gamma Rho Sorority Incorporated. And we're going to hear from Brother Andre Manson, International President of Iota Phi Theta Fraternity Incorporated. Let us hear them tonight. Please share this message. The world must know we cannot be silent anymore. Dr. Ward.
Thank you so much, Reverend Williams, and to Dr. Barber and Dr. Jackson and all of you for the work that you've done. We are so excited and committed as men of Alpha Phi Alpha Fraternity to join our fellow Divine Nine brothers and sisters to participate in this Poor People's campaign. We're going to be there, and I'm asking Alpha brothers from around this nation and indeed those around the world to be with us virtually on June the 20th. You know, we as a fraternity founded in 1906, when people said that we didn't have the intellectual capacity or the courage to stand up, we said then and we say now, we take no backward steps. And so today, the men of Alpha Phi Alpha will join in this fight for those who have no voice. That's our history. That's the history of the Divine Nine. And so 90 years we celebrate today and say that we are going to stand for our people and stand for those who need us now more than ever before. I want to leave you with a point of scripture that I share with my brothers all over this country and all over the world in my remarks to them. And it comes from Isaiah 6, verse 8. And it said, I heard the voice, and then the question was, who shall go for us? And the responder says, here I am, send me. And so tonight, the men of Alpha Phi Alpha join our colleagues, and we are saying, here we are, send us. And we are going to be there to fight for justice and fight for freedom and fight for those who have no voice. But they will have voice on June 20th. But more importantly, it's what we do after June 20th that's important. So we are going to fight against public policy issues that disproportionately have a negative impact on our people. We're going to fight against racism, as we've done for 114 years, and we're going to go to the polls and make sure that people are elected who will stand for the poor and for the least of these. And that's what our commitment is. So I'm asking all of us to join together. Doesn't matter what colors we wear, what year we were founded, we are in this together. So I'm happy to be with you and look forward to being with my fellow members of the Divine Nine as we move forward in our 90th year of celebration. So when the history book is written and they look back at June 20, 2020, they can say that the Divine Nine was there united together, speaking and standing against injustice.
Bishop Barber, Dr. Jackson, Sister Williams, and to Divine Nine leadership, and to all of you. Alpha Kappa Alpha supports this call to action and consciousness because it is important that we review and strategize around important issues such as voting rights, census, how COVID-19, the virus, disproportionately affects African Americans. And we contend that it is not just because our population is more susceptible to this virus, simply because we generally have higher incidence of diabetes or high blood pressure or respiratory challenges, or because we're overweight, But we contend it's because it's been years of racial disparities, unfair treatment when it comes to health care, inequities in the very standard of care. It's become very real very quickly. So we ask all of you to join us on June 20th. And let's make this the important day that it is. We're facing enormous challenges, but we're faced as one united spirit, moving in one consecrated direction. That's the time when we can truly recognize our call to action, a call to consciousness, and ensure that we will be all that God has destined for us to be. See you on June 20th.
Okay, gotcha. Okay. Good evening, all, and thank you for attending this very important and critically necessary discussion. I'm Reuben Shelton, the 34th Grand Pole Mark of Kappa Alpha Psi. And on behalf of the men of Kappa Alpha Psi fraternity, I want to thank Reverend William Barber and everyone who helped conduct this event and for inviting the Divine Nine presidents to participate. I am certainly honored to be here. Like other prominent historically African-American organizations, we have lost members to this virus. But at the same time, thousands of Kappa men continue to serve on the front line in this fight as healthcare professionals and first responders. All across the fraternity, our brothers are answering the call to assist our communities in various ways. Nationally, Kappa participates in the free and reduced lunch program to ensure students continue to receive the guaranteed meals they previously received at their schools. And Kappa men across the country have identified local food centers and in some cases opened doors to their chapter houses to feed students daily. Our brothers also formulated a plan to service our elderly and disabled neighbors by taking toiletries and supplies to senior citizens' homes and assisted living facilities. And in the face of these untimely and dire circumstances, we continue to press on. And we press on, continuing to advocate for the many needs of our community. We press on by developing a comprehensive voter engagement plan, partnering with organizations and signing on in support of mail-in voting legislation. We press on, continuing to push for justice for Black and Brown people, especially by offering our voices in matters like the Ahmaud Arbery case and the recent Minnesota tragedy. We press on by supporting our undergraduates who will be delayed entering the workforce or cannot find summer employment. In some cases, assist their families. We instituted a grant program for these undergraduates and recent graduates, allowing them to keep their hope and zeal to continue their quest to achieve in every field of human endeavor. Though COVID-19 is the only labeled pandemic that is hitting our community in seismic proportions, the missions of Kappa Alpha Psi, the National Pan-Hellenic Council, and the Poor People's Campaign will not acquiesce to it. That is why we proudly support our dear allies and friends in this movement and urge not only our members, but the entire international community to virtually attend the Poor People's Campaign on June the 20th and beyond. I assure you, Kappa will be in formation and in full force. And on that day, as we all continue to press on. You know, God is truly amazing, and He has not brought us this far to leave us now. He has brought us a mighty long way. He will stick with us, and He will walk by our sides. May God bless you, keep you, and give you peace. Thank you.
I am Dr. David Marion, the Grand Basileus of the Omega Psi Phi Fraternity Incorporated. Omega joins this effort as well, and I'm certainly calling on all men of Omega Psi Phi to support the Poor People's Campaign, this moral march, this march that is about values and principles on June 20th, 2020. Omega Psi Phi was founded November 17, 1911, And one of our cardinal principles, cardinal being one of our basic fundamental principles, is uplift. And it is our charge to brothers to not only uplift themselves and uplift each other, but also to uplift our communities. That is our charge, and that is mandated by our founders and by our Constitution and bylaws. And so it is no mistake that Omega is here, and Omega will be there with you on June 20th. We understand that poverty can't be so easily described as a culture of poverty, as if people are poor because they don't want to work. People are poor because they don't want to work hard. People are poor because they don't pray hard enough, or they don't pray right. We understand that poverty is based on conditions and circumstances that stand in their way. I'm reminded of when the young 15-year-old girl in Chicago was shot in the back, and Michelle Obama compared herself to this young lady. And this young lady had attended the inauguration of President Obama, and a week later was dead. And Michelle Obama said the only difference between herself and this young lady was access to resources and opportunities. So we understand in Omega Psi Phi that is the difference, that all things are not equal when it comes to resources. We understand what Brian Stevenson said in his book, Just Mercy, that the opposite of poverty is not wealth, the opposite of poverty is justice. It is equal access to resources, equal access to education, equal access to employment. Equal access is what we're talking about. My grandmama used to say that equal access meant one and the same. And that's what we want for people who are poor and low income. We want them to have one and the same access to everything that others have. And we believe when you have that, you will have equity when it comes to this. And so Omega Psi Phi will be present with you on June 20th, 2020. And I'm asking all Omega men to be on that call, on that digital gathering, be in that digital gathering for this Poor People's Campaign. Thank you so much.
Good evening, my sorors and fellow Greeks. I am Beverly Smith, the National President and CEO of Delta Sigma Theta Sorority Incorporated. Let me first take a moment to thank Reverend Barber and the Poor People's Campaign for their national call for a moral revival. I think the word revival is fitting in these circumstances. Many times a revival means it's coming together in a time of crisis to renew and restore our church family's vital and fervent relationship with God. And no doubt, at the root of our current crisis is that we as a country have systemically lost our way. Surely we can all agree that the time for revival ourselves, spiritually, morally, ethically, and economically, is way past due. We can't afford to ignore this wake-up call that the COVID-19 pandemic has provided. All of us are painfully aware of the lethal toll this pandemic has taken: serious illness and death, job loss and economic despair, social isolation, stress, and depression, toxic health hazards for essential workers, and food lines for those in poverty, as well as for those unaccustomed to needing help. We also know that this crisis, this unyielding crisis, has hit African Americans far more than any other ethnic category. But isn't it time for us to stop being number one in social, economic, and political disparities? What will it take for us to focus our collective need on our collective need rather than on our individual agendas? There's no doubt in my mind that our collective voice, our actions, and leadership can serve as an unstoppable force to empower and embolden our communities. So why does 2020 matter so much? Because we all know that this year, like no other year, is a year that we must get out the vote and participate in the census as if our inalienable rights depended on it, because they do. Collectively, we have an obligation to consider our role for advocating for the protection of our right to vote and against voter suppression. Let us not be fooled by this fake crisis to stop us by having the right to mail-in ballots when we know that mail-in absentee voting will probably be the primary way of voting during the 2020 elections. And while the focus must be on voter registration, it means nothing if we don't double down our efforts to ensure that our communities actually vote. Voter registration without follow-through voting is meaningless. I'm counting on my sorors and all members of the Divine Nine to fight for the protection of our voting rights, to be educated voters as we cast our ballots for those willing to understand and serve us effectively in the future, and to run for office themselves to guarantee that we are at the table, not only as participants, but as leaders. Collectively, we must participate in the census count for two main reasons: money and power. Money to ensure that our communities get their fair share of the almost $1.5 trillion spent by the federal government on over 200 programs. And power to provide the opportunity for us to gain electoral votes locally, nationally, and at the federal level. Collectively, we must act up and stand out at events like the Poor People's Campaign for the Moral March in Washington on June 20th. Now, just because it's a virtual march doesn't mean it'll be any less effective. In fact, because it is virtual, the power of our numbers, as seen through the eyes on social media, will make it tougher for us to be ignored as one united people. Throughout our history, we are not a people who have remained silent. The DNA of minorities has always contained a thread of true grit, of stamina in tough times, and of fortitude. This is our time and our season. My brothers and sisters, don't let a defeatist attitude be more dangerous to us than the virus itself. Thank you.
Good evening. This is Michael Crystal, International President of Phi Beta Sigma Fraternity Incorporated. Thank you to Bishop Barber and the Poor People's Campaign, and thanks for giving us the opportunity to participate. Hosea Williams, a proud Sigma man and civil rights legend, once said, "We build the path as we can, rock by rock." Brother Williams played a powerful role in the Southern Christian Leadership Conference and its Poor People's Campaign of 1968. He and his colleagues demanded economic and human rights for poor Americans of diverse backgrounds. Their call for economic justice was a response to the substandard material conditions of life for many African Americans at the time. Like Brother Williams, Phi Beta Sigma Fraternity Incorporated is committed to the moral imperatives of the Poor People's Campaign. For 106 years, our fraternities confronted head-on the interlocking evils of systemic racism, poverty, and ecological devastations of the United States and abroad. As a brotherhood of conscious men actively serving our communities, Phi Beta Sigma has built a path by empowering poor people to be agents of change internationally, nationally, and in their local communities. At the international level, we have 11 active international chapters operating in Africa, Asia, the Caribbean, and Europe. Our newest international chapter was established in Ghana, where we constructed the first of several boreholes, which will bring a clean water to hundreds of rural people. Additionally, we'll establish a trade school in Accra, Ghana, to teach skills to the people in the local communities and help them build their path towards a better quality of life for their families. Nationally, Phi Beta Sigma creates paths towards a moral revival and build up the power of people throughout programmatic areas of bigger and better business, education, social action, and our Sigma Beta Club. These initiatives mirror several key aims of the Poor People's Campaign. Our Bigger and Better Business program equips our communities with the skills and opportunities to rise out of poverty via employment and entrepreneurship. Our education program supports urban schools across the country with mentoring, supplies, scholarships, and advocates for policy reforms. Social action encompasses our civil engagement projects such as voter awareness and registration, as well as protection of those who typically face voter disenfranchisement. Through our Sigma Beta Club, we champion the health, well-being, and moral development of over 4,000 boys and young men of color we mentor. During the COVID-19 pandemic, we built a path through uncertainty and confusion to guide our people and empower them to care for themselves and their communities. To help ease the distress caused by isolation due to social distancing, we encourage our members to establish and maintain support by organizing activities such as conference chats, prayer hours, exercise challenges, and food and supply delivery services for our elderly community members. Phi Beta Sigma will continue to build paths towards economic empowerment justice, and sustained moral direct action. We welcome engagement and organizations like the Poor People's Campaign that share our values and seek every opportunity to support the works that reflects our organization's motto, culture for service and service for humanity. Because of the work that has been done and because of the work that is still needed, Phi Beta Sigma joins the Poor People's Campaign, but also encourage all of our members to participate. We will be there in large numbers as we embark upon Washington on June 20th, but more importantly, we anticipate and expect a huge impact on that particular day. We thank you, but more importantly, may God bless the family of George Floyd, who was murdered by the police officer in Minneapolis. Thank you very much.
Good evening. My name is Valerie Hollingsworth Baker, and I am the president of Zeta Phi Beta Sorority Incorporated. I want to thank Reverend Barber this evening for having us on the Poor People's Campaign town hall meeting. This is so very important, and Zeta stands with this organization because it is important for our people to understand where we are, where we're going, and how we're going to get there. Now, all of the Council of Presidents realized early on that COVID-19 was having and would continue to have a significant impact on our constituents. To better understand the impact on Zeta's members, on April 20th, a survey was issued to the sisterhood by the National Statistics and Mental Health teams. The purpose of the survey was to identify our essential workers and their needs, understand the mental emotional effects of COVID-19, and to provide support for our national mental health team by nurturing a strong sense of sisterhood and involvement. The survey results allowed us to target our efforts and deliver unprecedented service to our members and the community. Notably, 60% of the respondents are frontline or essential workers, or they live with them. Shifting to the economic and social impacts, the survey results told us that 15% of the respondents are either unemployed or on furlough, and 47% of the respondents are at home with children, and 21% are family caregivers. Finally, 35% of our survey participants affirmatively stated that they needed support from our mental health team. Armed with this detailed data, Zeta Phi Beta Sorority quickly launched unique programming or rebooted existing programming to address the mental health, emotional, social, and financial needs of the sisterhood in the community. First, due to careful financial planning, full refunds were being issued for any canceled or postponed national events, so the registrants have the funds to assist with their financial needs. Next, late fees for our individual chapters and assessments will be waived wherever possible. I'm very proud of that the regions, states, and chapters have instituted various financial SOS programs designated to help those that have lost their jobs or have been furloughed. To promote the continued service despite the pandemic, Zeta added virtual components to all community service and social action programs. That included programming under Zeta's mental health initiative, Zeta Sings the Blues. This initiative is implemented by a team comprised of mental health professionals. In addition, every region has licensed therapists that serve as mental health coordinators to ensure impactful programs are scheduled on regional and state levels. The national team put together a wonderful webinar series on self-care, coping, post-traumatic stress disorder, as well as bi-monthly coping recommendations disseminated through our international news brief. We also recognized that our younger members needed their own programming, so our undergraduate leadership sponsors webinars designed to help them to cope in the times of crisis. Next, the regional and state undergraduate coordinators were charged with performing sisterly check-ins with every undergraduate. I'm proud to announce that in the response to the surge of intimate partner violence due to the pandemic, I will be appointing an international intimate partner violence director and team. Not only has there been a surge nationwide, but unfortunately, we have experienced a direct impact to our sisterhood with loss of members due to the domestic violence related incidences. Studies show that Black girls and women are hyper vulnerable to abuse, and Black women are killed at a higher rate than other groups of women. Zeta's programs have truly transformed lives. And on June 27th, every Zeta chapter and auxiliary across the nation and abroad are being asked to deliver meals to our essential workers. We will close out our fiscal year with issuance of 10,000 backpacks filled with school supplies to be donated to several schools in the DC area that are in need of these supplies. And we will be awarding our first $100,000 scholarship to a deserving young girl who is graduating from high school this June. I'm immensely proud of my sisterhood as we continue to provide service to our own while also maintaining the highest level of service to our communities. So in closing, I would like to say we are our sisters and our brothers' keepers. It is time for us to stand together, and Zeta will be there on June 20th, standing with the rest of the Council of Presidents and other organizations to support Poor People's Campaign, because it is important that we are there because we are doing the work of God's people. Thank you.
Good evening to Reverend Barber and the Poor People's Campaign members, all of my sorors, and members of the Divine Nine. My name is Deborah Catching-Smith, International President of Sigma Gamma Rho Sorority Incorporated. We have heard the national call for a moral revival, and we stand ready. The women of Sigma Gamma Rho Sorority stand united with the Poor People's Campaign and members of the Divine Nine organizations. We know just how important it is to participate in such an insurmountable and worthy cause. We stand united with all of the trailblazers that have come before us and those who are joining us at this moment in time. Each have been laser focused on ways to challenge and to work with the inequalities that prevail in all of our communities across this nation. When we gather virtually on June 20th, we want you to join us and leave that particular event inspired. We want you to be inspired to action. Be inspired to complete the U.S. Census form if you haven't already done so, because there is too much that is at stake for us if you don't. Be inspired to register to vote if you haven't already done so, because for sustainable change, for us to experience that, we must vote. And most importantly, we must know the issues that impact our daily lives on all levels of government. Local elections are just as important as national races. Don't get distracted. Remain focused, because there is too much at stake and we must take action. May God bless the Poor People's Campaign, the National Pan-Hellenic Council, the women of Sigma Gamma Rho Sorority, and all Divine Nine members on the front lines for change. Thank you.
Good evening, everyone. Proper protocol already being established. I would like to thank you all for joining us here this evening. My name is Andre R. Manson. I'm the 22nd International Grand Polaris of Iota Phi Theta Fraternity Incorporated. Like my colleagues before me, my task this evening is to talk about the COVID-19 and how it affects the Black and Brown communities. As has been stated, studies find that Black communities account for a disproportionate number of COVID-19 deaths in the US. There is new evidence that even more African Americans may be dying from the coronavirus in the United States than white or other ethnic groups. Black Americans represents 13.4% of American population, according to the US Census Bureau. But counties with a higher Black population account for more than half of all COVID-19 cases and almost 60% of deaths. And the numbers are still growing. And I believe the reasons they're going to still grow are the usual suspects. There's not enough testing in our communities, lack of healthcare access. We as African Americans have a lot of underlying health issues, and many of our communities are not taking it serious enough. And of course, the nutrition and food deserts that are high in our communities. To put it boldly, I think the powers that be will not make an aggressive move until it hits the communities that they're in. Much like the war on drugs, the opium crisis, and other concerns, until it becomes an issue within their communities, our government may accept the disproportionate effects it has on a minority group. The lack of balance in health initiatives, education, and community resources are things that are not going to have the same level of emergency within the government due to the fact that it's not in their communities. The question is, how do we address this? Why should COVID-19 be like everything else that ravages our communities, like drugs, literacy, economic disparity, and other social preventable issues? I believe the only way we can make a change is to come together and stand for what we need, to join our voices, and by getting involved. So I am calling for all of the members of Iota Phi Theta Fraternity Incorporated, our affiliate organizations, and others to join us on June 20th for the Poor People's Campaign, a national call for moral revival, to remind the powers that be that we are not to be forgotten or to be set aside when it comes to the issues of health and the welfare of our communities. So I say thank you again for joining us, and to the coordinators of this much needed program. And remember, our communities are counting on us. Thank you.
Thank you, Presidents. We thank you for your words on tonight. And if I would just run the record tonight and call the names of members from all of these very illustrious organizations, I wonder what Martin Luther King Jr. would say tonight. I wonder what Coretta Scott King would say on tonight. I wonder what Reverend Ralph Abernathy would say on tonight. I wonder what Bayard Rustin would say on tonight. I wonder what Fannie Lou Hamer would say on tonight. I wonder what Brother Hosea Williams would say on tonight. I wonder what Zora Neale Hurston would say on tonight. I wonder what Sandra Bland would say on tonight. And I wonder what Mr. Albert Bus Hicks would say on tonight. If their names would call, they would say, we got to go to DC, virtually, even if we can't go in person, because this country has failed us for too many years. And so tonight, our presidents have called us to action. And so here I am asking you all, as I know if those names I just said were here tonight, they would call you and say, go on to June2020.org and sign up tonight and join us as we go. As my president said, President Beverly Smith said, we are going and we're going to show up on digital web streams to let this country and this world know you will not continue to oppress us and keep us down. We will rise, and we will rise together for the 140 million poor low-income folks in this nation. So right now I'm asking you, pull out your phones, whatever you got, your computers, and go to June2020.org. Hear me again. Go to June2020.org and sign up today, because we will not be silent anymore. And we need all of us together to make the change. Thank you, presidents, for speaking for us tonight. And we are looking forward to having your membership with us on June 20, 2020. Reverend Barber.
Thank you so much. Thank you so much, Reverend Williams. And thank you for your impassioned plea. And thank all of these presidents. I'm sitting here, I was teary a minute ago and thought about this is the week of Pentecost, the week when folk came together in the time of a narcissistic tower building leader who loved to put his name on buildings, but they came together in the power of the Spirit. And the first thing they did was they set up a way to care for everybody in that community. 2 years ago, Erica, and Dr. Jackson and Dr. Ward and others and Dr. Glover, when we called for this Poor People's Campaign, we didn't know COVID was coming. And we started mobilizing across the country, but what we knew was 140 million people were poor and low wealth. What we knew is that we needed to finish some work and continue some work and bring together people regardless of their color. That's why on June 20, 2020, white and black and brown and red and yellow and gay and straight and young and old, people of every different culture will come together around an agenda to say we will not be silent anymore. Why June 20, 2020? Because the 21st of June is the summer solstice. It is the time that light is closest to the earth. And don't we need light right now? My God, we need light right now, light in the midst of this dark. Why June 20? Because it's after all the primaries and before the conventions. And so, as many of you have said, we rise up and we do this digitally and we show our numbers, and it pushes the policymakers to have to understand they can't ignore this. We cannot continue to spend trillions of dollars. We have a stat that says we spend 53 cents of every discretionary dollar right now on defense and less than 16 cents of every discretionary dollar on public education and healthcare and infrastructure. If we just had one of those contracts, it could fund every state where healthcare has been denied by these very governors that are trying to rush people back into society, but they have denied Affordable Care Act or Obamacare. Why June 20? Because it's right after the primaries, before the convention. Why? Because it gives us the whole summer to register people for the movement who vote. And then and we're going to release a piece that we've had done that looks at every place in this country where if poor and low wealth, black, white, brown, red people organize around an agenda, if they would do that, just 15% of them that are not registered and vote, not 30, not 40, just 15%, they could fundamentally shift the political calculus in this country. Each of our coordinating committees are organizing 30,000 people in every state around this agenda and around registering people for the movement who vote. Reverend Williams is a part of that group and many others. She's organized a group of young people, her and Dr. Colleen, of young people who are part of this movement. I want you to know on June 20th, 2020, we're doing a special MASH video with all the presidents. We want you to speak to that day on next one of these MASH videos. They put everything together. Danny Glover has said, I want to be, I don't have to speak, but I want to come, and then maybe that'll draw other people to see poor and low wealth people. Jane Fonda says, I want to let folk know I'm coming. Wanda Sykes, Killer Mike, Vice President Gore said he's coming out of Cambria. He's coming not to speak on behalf of people, but to draw in people to see and to hear. Erica Alexander, who played on Living Single, she's organizing. Joan Baez, who was with Dr. King, said, I got one more fight in me. I'm coming. Just this past week, MSNBC says we can have the whole platform. They've lent it to us so that we can have a massive platform. Joy Reid is doing a special this coming Sunday, and she'll be there on the 20th. Ali Vash is coming. WPFW, an international radio station, says we're going to do it live that whole day. It is time, y'all. It's past time. And the right time to stand up is right now. Somebody asked the other day, Erica, they said, do you want us to change the healthcare system in the middle of a pandemic? My response was, we changed slavery in the midst of slavery. We changed women's suffrage in the midst of the time when women couldn't vote. We changed Social Security and minimum wage in the time of Great Depression. We changed Jim Crow in the time of Jim Crow. The time to change things is when it no longer works and it's no longer right, and it's clear that we have a new moral code. And so thank you to every one of you. Erica, thank you for a powerful job. Reverend Jackson, thank you. And to all the presidents and all of the brothers and sisters that are on the line, thank you so much. And Yara and her sister, Sauda, come on and take us out of here, because we sing our way through, even as we fight.
Hold on, keep Keep your eyes on the prize. Hold on. Hold on. Hold on. Keep your eyes on the prize. Hold on. Justice's name is mighty sweet. Keep on working and we're gonna meet. Keep your eyes on the prize. Hold on. Got my hand on the justice plow. Wouldn't take nothing for my journey now. Keep your eyes on the prize. Hold on. Hold on. Hold on. Keep your eyes on the prize. Hold on. Well, there's one thing that we did wrong. We stayed quiet just a little too long. Keep your eyes on the prize. Hold on. But here's one thing I know we did right. Open our mouths and we started to fight. Keep your eyes on the prize. Hold on. Hold on. Hold on. Keep your eyes on the prize. Hold on. Well, there's one chain that man can stand. That's the chain of a hand in hand. Keep your eyes on the prize. Hold on. Keep your head up and stay on track. Forward together, not one step back. Keep your eyes on the prize. Hold on. Hold on. Hold on. Keep your eyes on the prize. Hold on. Hold on. Hold on. Keep your eyes on the prize. Hold on.
Amen.
Can everybody come off mute? All my presidents, come off mute. We this wasn't in the program, but what we do in the Poor People's Campaign, we have a chant called Forward Together and Not One Step Back. So all my presidents, come on, because we got to let the world know tonight we're going forward together and not one step back. So NPHC presidents, where you at? Forward together.
Forward
Not
together.
one step back.
Step back.
One step back.
Forward together. Not one step back.
Not one step back. America, we're not going one step back. So we look to see all of you on June 20, 2020. Have a good night.
God bless.
Great job.
All right.
No backward steps.
Nope.
That's right.
Nope, not at all. Not at all.
Amen. Amen.
Great town hall. Great town hall.
Great.
Dr. Jackson.